My name is Dr. Carol Angel. I'm a colorectal surgeon at Piedmont Rockdale. Colorectal cancer is a cancer that starts in the colon or rectum, which together makes up the large intestine. Colorectal cancer starts out as a small growth in the lining of the colon or the rectum, and these are called polyps. Polyps can then develop into cancer. Some can not be benign, but others develop into colorectal cancer. Colorectal cancer is the fourth most common cancer in the United States, behind breast, prostate, and lung cancer. Fortunately, the rate of colon cancer has decreased in the last 40 years due to increased rates of screening. However, it must be noted that we have recently seen an increase in young patients under 50 years old being diagnosed with advanced stages of colorectal cancer. Colorectal cancer can be prevented, and screening is a big push recently in getting people screened for colorectal cancer. There are many different modalities that we can do for screening. Colonoscopy remains the gold standard. However, the best screening tool is the one that the patient is going to complete. People that are average risk for colorectal cancer, we begin screening at age 45. Lifestyle changes can also be beneficial at preventing colorectal cancer. We recommend a diet high in fiber, fruits, vegetables, beans, lentils, low processed meats, avoiding red meat, and healthy lifestyle changes can all help decrease your risk of developing colorectal cancer. Smoking and alcohol also increase your risk for colorectal cancer. So if you smoke, quit smoking and limit your alcohol intake. Anyone that is experiencing abnormal symptoms such as changes in your bowel habits, constipation, diarrhea, bloody bowel movements should be evaluated for the potential for undergoing a colonoscopy. It is a relatively short procedure that does take some prep into taking, but it is an outpatient and you go home the same day. You will undergo a bowel prep, which is different depending on your doctor, but you will be typically on clear liquids for one full day. Do the bowel prep. The bowel prep consists of a laxative solution that will clean out your colon for the colonoscopy. During the procedure, you'll be kept comfortable with sedation, and we insert a thin tube with a camera on the end and examine your entire colon. And colonoscopy is such a great screening tool because we are able to also prevent. It is therapeutic and it's diagnostic, and we can prevent colon cancer from forming by removing the polyps at the time of your colonoscopy. After the colonoscopy is done, you might feel a little groggy from the anesthesia, but you recover the same day and are able to go home the same day. If we remove any polyps at the time of the colonoscopy, we always send those to the pathologist to examine and determine if the polyp is benign or cancerous. If you become diagnosed with colorectal cancer, there are many treatment options available, and some cancers are even curable with surgery alone. Other treatment options include chemotherapy, radiation, and even immunotherapy in conjunction with surgery. The treatment team for you may include your gastroenterologist, someone like me who performs colorectal surgery, and your oncologist or cancer doctor. The thing I'm most excited about colorectal cancer screening and prevention is that patients are getting screened sooner and we're catching these at earlier stages. We have increased awareness and increased the amount of people that are undergoing colorectal cancer screening. Surgery today is more precise, and we're able to treat with more minimally invasive techniques such as laparoscopy and robotic surgery, which means shorter time in the hospital, faster recovery from surgery, and quicker back to your everyday life after getting surgery. We are now able to study these cancers at a more genetic level and have more targeted therapy for these cancers. If you're interested in undergoing colonoscopy for colorectal cancer screening, you can always go to piedmont.org, find a doctor, and search for a gastroenterologist or colorectal surgeon. I do perform colonoscopies, and you can call my office anytime to schedule an appointment with me, and I'm more than happy to talk to you about any questions that you may have.